Let's bring in Dr. Georges Benjamin for more on this meeting. He's the executive director of the American Public Health Association. These health ministers making this commitment, 40%. What kind of a big difference maker can that be? What kind of impact are we talking about here?
Look, this is an important commitment because this is the 20 largest economies on the planet getting together and saying, look, by the end of this year, we want to make sure that we can get to 40% of the people on this planet, and by mid next year to 70%. Those are good baseline goals. Hopefully they'll be able to beat those goals, but they've done a comprehensive look at what's necessary to get us there. The issue now is actually living up to those agreements.
And these countries are also talking about coordinating strategies moving forward, but we've seen such a disjointed approach to tackling the virus here in the U.S. I mean, things can change as you move from one state to another. I just got back from a trip to Iceland where there's a robust testing and tracing environment. You have to get the test before you enter the country and when you leave as well. So with so many varied approaches, how do you come up with a unified global strategy?
We've got to follow the science. The science is pretty clear. Testing followed by contact tracing and getting everyone vaccinated is the way to go. And we've got to just make sure that everybody is following the science and coming up with some agreements that make sense for us to really get our hands around this. Look, you heard that infection anywhere makes us all at risk everywhere. And until we do this, we're not going to get our hands around this pandemic at all.
Dr. Benjamin, we heard in that report 5 billion doses out there, 75% going to 10 countries, 2% in the African continent. We've seen what the Delta variant can do, and the longer this is out there, the more chances there are for other variants. I mean, give me your belief system as we move forward about why it's so important to get more people with these jabs.
You know, as long as people are getting infected, we're going to have variants that are going to happen. That's exactly what these viruses do. They infect other people and they mutate. They infect other people and then they mutate. So until we can stop them from infecting people, basically by getting everyone vaccinated, they're going to continue to mutate. We're really worried about Delta, but now we've got Mu out there, which is another a variant that seems to be able to maybe even be able to escape some parts of the vaccine in some parts of the world. And that's not the latest one. There are just many variants out there that we're watching.
And the Italian health minister is out there saying more needs to be done to close the gap between wealthier and poorer countries when it comes to the vaccine. But there's also been some people who've expressed some annoyance that wealthy countries like the United States are already talking about booster shots, you know, the third shot, while other parts of the country, the world, I should say, haven't even gotten the first jab. How do you balance all of this?
You know, we're going to have to do both. Certainly, we now understand that there are some people who are not fully vaccinated, particularly people who are immunocompromised, and those people will need to get a third dose. As you know, the decisions around actually who's going to get boosters and when those boosters occur is still a hot debate in the United States. But as you know, the rest of the world is beginning to give people more boosters, and we're going to have to do both. And by the way, we have to do both. We have to make sure that everybody is adequately vaccinated. We don't want to over-vaccinate anybody, but it's going to be very important to get these vaccines to the rest of the world. And getting to the rest of the world has got to be our top priority.
Dr. Benjamin, thanks so much for your time. Really appreciate it.
Thank you.